everyone. My name is Claire Simmons. I'm a communications director here at Atrium Health. Thank you for tuning in for another installment of our lung cancer conversations. We are bringing you our top experts to go over everything you need to know as you navigate a lung cancer diagnosis. We're going to go right ahead and get started. Today we have two incredible guests, Dr. Kathryn Mileham and Dr. Sarah Galloway. Dr. Mileham, welcome.
Thanks, Claire. It's great to be here.
Hi, Dr. Galloway.
Hi.
All right, Dr. Mileham, we're going to go ahead and start with you today. If you could please begin by giving us an overview of what goes into designing a personalized treatment plan for lung cancer patients.
Yeah, it's a great question, Claire. When we think about treating lung cancer these days, it's really become quite complex. And a lot of that has to do with making sure that we're designing a treatment plan that is personalized and specific to the person. And I really try and simplify that. A lot of people that I see in clinic, they hear me say that I need to know where the cancer is, what the cancer is, so I know how to treat the cancer. And by the where, I mean, let's get scans. Let's make sure that we have a look at the entire body. It's not just about looking at the lungs. We need to know what's going on in the brain. We need to know what's going on in the liver and the bones. And so we want to make sure that we've done all the right scans to know where the cancer is. And then the next step, as I mentioned, is what is it? Lung cancer is really many different cancers. We can't just say we have lung cancer. We now break that down even into not just non-small cell and small cell, as traditionally many people have heard, but we go down to the genetics of the tumor. What's driving this cancer? What makes this cancer unique? And then once we gather all of that information, the where and the what, next is the personalized treatment plan based on this information. And there are a lot of different treatment modalities that we utilize for each person based on all these findings. Not all cancers are best treated with surgery. We may use other localized or focal treatments with radiation. And most times, people benefit from having what we call systemic treatment, which is a big word, to make sure that we're covering the whole body. And there are a lot of different ways that we address that based on the tumor information that we've learned through pathology.
That was a great breakdown. Thank you so much, Dr. Mileham, for taking a very complicated topic and making it understandable. So our second question for you is, what is a molecular study and what does that process consist of?
Yeah, so a molecular study is really just looking at the tumor DNA. This is not the DNA or genetics in the person. We want to know about the tumor itself and what is driving it. And that's different in different tumors. And we know that lung cancer is a variety of mutations that may be what's driving that cancer to grow and spread. And we use that information to go back to that personalized treatment plan that you had just asked about. You know, for example, this isn't just chemotherapy that we use anymore to treat lung cancer. We think about maybe as a traditional treatment, and we still use chemotherapy to treat lung cancer because it kills dividing cells, and cancer is dividing and growing, and that's why chemotherapy is very helpful. We also use immunotherapy, as a way for the body to recognize cancer as foreign and go combat it or kill it, the cancer. And then we have targeted therapy. And that's a term that refers to a lot of medications. Most of them are pills that go directly against a biomarker or molecular marker or change in the DNA structure of the tumor. For example, if the tumor has an EGFR mutation in it, we get that information and we know that we have an effective and well-tolerated anti-EGFR therapy. So we would want to make sure that we're using the best treatment based on what's driving that cancer. And sometimes it's just as important to know that a tumor doesn't have that mutation. For example, it's important for us to know that a tumor does not have an EGFR mutation so that we don't spend time and effort using an anti-EGFR treatment there. It won't work and it could have side effects. So it's just as important to know whether it's there as it is important to know that it's not there. So again, we go back to that personalized treatment plan.
And maybe the last step in this process is about imaging. So how does imaging come to play when you're developing these plans for patients?
Yeah, I think that misperception is that that there are certain types of scans that are the holy grail for the treatment plan. I think it's important for people to know that we are choosing a certain type of imaging that we feel is the best to uncover, help us better understand what's going on. For example, many people are asking about PET CT scans, and absolutely we use those as a part of the diagnostic evaluation, meaning when somebody is diagnosed with lung cancer and we're looking at the whole body, we use that type of scan to look from essentially here to mid-thigh for any location of the cancer. But it's not the only type of scan. And so we very much use CT scans in and of themselves to give us really good pictures of the inside, whether that's the lung or maybe the lymph nodes, the adrenal glands, other parts of the body. When we look at the brain, we prefer to use an MRI, and we know that a lot of people have anxiety about being in smaller spaces, but we want to support people in getting that really good picture of the little tiniest changes in the brain so that we can anticipate and be prepared to manage anything such as cancer that could spread to the brain. X-rays still have a great place for looking at bones and also fluid collections and ultrasounds to look at the blood vessels and even other fluid collections. So there are still a lot of different types of images, and anybody's medical oncologist may choose a different type of image specifically for what they're trying to gain some knowledge. And I would just add another comment about PET CT, that it's not a cancer scan, and I think that a lot of people aren't up to date on really what a PET does, but it's really looking for activity. And certainly lung cancer has a lot of activity. And so lung cancer tends to show up bright on a PET scan, but there are other cancers, including some less active lung cancers, that may not show up as bright on a PET scan. So when I hear somebody say that it's a cancer scan, yes, we use it to identify and really hone in on any kind of cancer findings throughout the body, but we're not tagging the cancer cells specifically. And so it's a great area for us to take responsibility and educate patients and family members and care providers about the differences.
Excellent. Dr. Mileham, I know at LCI you have been heavily involved with several clinical trials and enrolling many of our patients in there, some of who have had amazing success on the trials. How do you and the team determine when a patient might be a candidate for a trial? And obviously this is a really big topic, but if you could hit on some of the high points as somebody is, beginning their journey and they're curious about it, could you give us an overview of that process?
Absolutely. I think we're always and should always be considering whether or not there's an opportunity to participate in a clinical trial. And I think there's some misperceptions about really what that means. What does it mean to be involved in a clinical trial? It's really an opportunity to receive some sort of intervention or be a part of something that may be novel or new that would best suit the person. And that doesn't necessarily have to be when you're diagnosed. It could be at any time during your treatment plan. And there are a lot of different clinical trials. Traditionally, we may think about one that we get a type of treatment. And that might be a new treatment that's in development. It may be a treatment that's already been proven to be effective in a different type of cancer, but we want to try it in lung cancer. For example, there may be a breast cancer drug that we think would be very beneficial in lung cancer. We already know how it's given. We already know the side effects. We just feel that there's an unmet need and an opportunity for someone. There are other clinical trials that don't involve receiving a treatment. For example, there may be a clinical trial that only includes blood draws. Now, we know people with cancer go to the lab and they get their blood drawn pretty frequently. We have many different opportunities where one extra tube every so often would be a way to participate in a clinical trial that may not be a treatment intervention trial. And so it provides a patient an opportunity to be a part of something that will help us learn what we should be developing in the future. So it's sometimes the first step of trailblazing that path for us to understand what should be the next thing that we study. So I just think that trials have a lot of different facets, and there are a lot of advantages, not only to maybe receive a new treatment, but also to have a large care team. It usually involves some extra nurses, and recognizing that all of these clinical trials are designed ethically with safety and privacy as the priority for the patient.
That was a great breakdown. Thank you, Dr. Mileham. Thank you for all the work that you do for lung cancer patients and your unwavering devotion to the cause. We truly appreciate everything. So thank you for sharing your expertise with us as well today.
Thanks, Claire.
All right, Dr. Galloway, we would love if you could start by introducing yourself and maybe just say a few words about who you are, what you do at LCI, and then we'll go right ahead into your Q&A section.
Great, Claire. Thank you for having me with you today. So I'm Dr. Sarah Galloway. I'm a clinical psychologist here at LCI in the Department of Supportive Oncology, and am involved in direct patient care, research, and then also education. So working with our hematology oncology fellows, and then also our psychology fellowship program that we have here at LCI.
Great, thank you. Something that we definitely want to talk with you about today, Dr. Galloway, is anxiety. And in general, I think everybody struggles with anxiety, but I can only imagine if you are facing a cancer diagnosis, I am sure that anxiety comes up quite a bit. what are some tips that you would have to help people cope with their anxiety?
That's a really great question, Claire. First of all, like you were alluding to and kind of recognizing, is that changes in mood and worry are very common with individuals who've been diagnosed with cancer. And in fact, our scientific literature suggests that about 42 to 56% of individuals with a cancer diagnosis will meet criteria for a psychiatric disorder as well. And what we know out of those individuals, a large majority of them experience both kind of anxiety, so worry, and then other types of anxiety, more physiologic types of anxiety perhaps, and then also depressive disorders. And our own data here at LCI suggests that roughly about 20% of our patients will meet criteria for a depressive disorder, and then 20% of our patients will meet criteria for an anxiety disorder as well. And frankly, I believe that this is an underestimate as well too. So it's a really common issue with patients that have a lung cancer diagnosis. My first tip actually is for patients to tell their oncologist that they're experiencing worry or changes in mood. In our culture, low mood and anxiety or worry, mental health issues and needs, it's stigmatized. And so a lot of times people don't actually tell their oncologist that they're experiencing these issues either. And so it becomes really difficult to address those needs if they're not in kind of direct communication with their physician about these particular issues. And so I would really prioritize this as kind of a need and an issue to be able to kind of tell their oncologist about. So in addition to communicating this with their oncologist, and their oncologist can really figure out how to triage what's going on with the patient and then refer them to appropriate services that we have in-house here at LCI. So another tip would be also there can be some lifestyle and behavioral modification changes that can be really helpful to be able to impact mood and to impact anxiety. So first, I would recommend for them to keep physically active. And this can be very difficult in process of a cancer diagnosis and going through treatment. But we know from our literatures that this can be very helpful for stress and distress that patients might be experiencing. And then also, for fatigue and some of those other issues that they might also be experiencing too. Next, we see a relationship between anxiety and changes in mood to alcohol use, to nicotine, to caffeine, beverages, or recreational drugs. So these substances can all cause or worsen anxiety for patients too. So one of my recommendations would be to avoid these substances, and in other cases like caffeine, to be able to reduce intake of caffeinated beverages as well. Stress management and relaxation techniques can be very helpful for patients too. So some examples would be visualization strategies, meditation, progressive muscle relaxation can all be helpful for distress and then anxiety management too. And then my last tip would be social support. So really being able to pull on social support. And I know social support changes oftentimes for folks that have been diagnosed with cancer and then are also going through treatment. And then I know, right now, as we're talking too, we're also in the middle of a COVID-19 pandemic too, which can have a direct impact on social support too, in terms of how that's experienced. But social support is really important for helping us to be able to cope with distress and with anxiety and changes in mood. And what I think about here is it's a quality, not necessarily quantity game too. And so when I talk about a quality relationship, I'm thinking about someone in which they're able to really talk about more vulnerable thoughts and feelings and fears that you might be experiencing without fear of judgment. And it's not necessarily like the number of people that you have kind of around you that really is helpful for anxiety.
That was great. Thank you for those very tangible tips, Dr. Galloway. When it comes to cancer, I know a lot of times everybody is familiar with the physical side effects, whether it's the nausea or the hair loss or the weakness, but what's not talked about nearly as much are the emotional side effects of cancer. And I know you talked on that a little bit previously, but if you could share some information about how you and the team at LCI help patients who do have emotional needs as they go through treatment, how do they get that type of support?
Yeah. So the first place that we start is really a comprehensive and full evaluation in that first meeting. So what we're going to want to try and understand is what have you been experiencing? What's gone on in the past? What are you currently experiencing right now that might be impacting kind of the symptoms that you're experiencing or how you're feeling? And then based upon kind of that full evaluation, we come up with a comprehensive treatment plan, an individualized comprehensive treatment plan with the patient to really try and meet their goals. And there are 3 different pathways that I think about and that we talk about with our patients to really address anxiety, distress, changes in mood. The first pathway is a medication-based pathway. The second one then is a non-medication-based pathway, so more behavioral methods to be able, in scientifically supported behavioral methods to be able to address changes in mood and worry. That might look like cognitive behavioral therapy, mindfulness-based strategies, acceptance and commitment therapy, and then behavioral techniques to be able to reduce physiologic anxiety that patients are experiencing. And then the third pathway is a combination of both medication approaches and treatments with non-medication treatments as well. And individuals tend to go down different paths for different reasons. They might have kind of individual thoughts or experiences with one of these particular pathways that might influence kind of their approach or desires in terms of what treatment approaches to approach or to go through. We also will be looking at severity of symptoms as well too, in terms of what types of pathway we might, or which pathway we might recommend for our patients. And then also, you know, we do want to take into account their history too, in terms of prior diagnoses, you know, before their cancer diagnosis with kind of mental health issues that they've had in the past.
Great, thank you. So let's talk a little bit about timing. At what point in a patient's journey with cancer should they seek out this type of care? And do they ever get phased out of the program, or is it forever? Is it too late if you don't join on day 1? Can you break that down for us?
That's a really good question. And what we find is that individuals experience stressors, or they experience anxiety and depression, changes in mood or worry across all phases of their cancer journey. Okay, so from the initial kind of workup for abnormal finding to an actual diagnosis, to engaging in treatment and starting treatment, changing treatment modalities, from remission, recurrence, and then across kind of advanced disease or terminal illness. So you will experience kind of stressors along all points of this trajectory. And really, it's important to be able, you know, we help folks across all of periods of time throughout that trajectory. And we find too that anxiety or depression or changes in mood and worry can rise and fall throughout this trajectory too, with some points of the anxiety or the changes in mood to be much higher than at other points. And then at other points in that same kind of trajectory that it their anxiety might escalate or it might increase as well too. And so I think it really is kind of our doors wide open for folks kind of across all of these different points in time.
For anybody watching this who may not be a patient themselves, but who has a family member, a friend, a loved one who's going through cancer, and they are noticing some of these signs of emotional distress or challenges, what advice would you have for them as to how they can help? Any little things they can do, whether it's cooking a meal or writing a card or holding their hand or listening, anything at all that we could arm ourselves with to be a good support system for our loved ones?
My initial gut response to that is communication. So really falling on good communication and fostering good communication with your loved ones or the individual that is experiencing cancer. And first and foremost, I'd ask them what they would want or what would be most supportive to them too, because it might vary by individual in terms of what that support might look like. So I think that's a very important question for the loved one to be able to ask the individual with cancer. Second, in terms of kind of fostering kind of communication, asking your loved one, we know that communication can be very difficult with kind of around a cancer diagnosis, and oftentimes communication becomes very stilted. Talking about cancer can be very taboo. And so people often avoid talking about cancer with their loved ones. And so I think that just an open and honest conversation can be really useful.
Thank you, Dr. Galloway. I think between you and Dr. Mileham, patients are definitely in great hands. And while nobody wants to be going through a lung cancer diagnosis or any type of cancer, I think having the support system that is LCI on their side is tremendous. So we really appreciate your time today. Any last words from either of you before we say goodbye?
I'll add one. Claire, I think we're so fortunate at Levine Cancer Institute to have such a broad array of resources for our patients, their care partners, their families. For example, a lot of what I spoke about today was really just the nuts and bolts, right? The nitty gritty. What are kind of our high level thoughts when we're just struck with a diagnosis of lung cancer? What should I be thinking? What are they going to do? What are the things that maybe my medical oncologist is going to be discussing or looking into on my behalf? I think what's most important about our conversation today is what Dr. Galloway and her team can provide that's unique to maybe other places where people can receive care, and just recognizing that this is such an important part of care. It's not ancillary. It's really very integral to being successful in the cancer journey, because it's not just about the tumor, right? It's about the person. And so what Dr. Galloway and her team provide is truly an all-encompassing approach to cancer care that should be the way that all cancer is managed now and moving forward.
Thank you, Dr. Mileham, and thank you, Dr. Galloway, as well, for your time today. We appreciate everything you do, and thanks to everybody who tuned in today to watch this special episode of Lung Cancer Conversations. We hope you found it useful. If you did, please feel free to leave us a comment or share it with a friend. Until next time, wishing you the best day. Talk to you soon.